My name is Aki Dixon-Vestal, and my topic is more paramedics in emergency department as feasible solution for nursing shortage. Situation: Dartmouth Hitchcock Medical Center, or Dartmouth for short, emergency department, or ED for short, is a very busy unit. The number of staff required to meet and serve the local population's persistent demands is proving difficult. Registered nurses, or RNs for short, are required resource to an effective ED, as their scope of practice and the competency in the various skills are unique when compared to those of other hospital units. However, the ED has a short of RNs almost every shift. Background: the United States faces an ongoing shortage of RNs. This is expected to become more critical in 15 years or so, when baby boomers retire. Now, baby boomers are accounting for 40% of actively working RNs, so they are predominant RN workforce. Dartmouth ED is no exception. On top of the retiring baby boomers, many RNs, especially younger nurses, leave the hospital ED because they are pursuing further education and more new different experiences. The Dartmouth ED needs to fill the immediate void of RNs. I propose the ED should consider hiring more paramedics who traditionally work for fire stations and ambulances as alternative resource, while new generations of RNs are being trained. Assessment number 1. Although there are a few limits to paramedics and the RNs share similar skill sets. They are well trained with IV insertion, drawing blood, EKGs, advanced cardiac life support, which is CPR with cardiac medication administration, and strokes and chest pain protocols, to name a few skills. Assessment number 2. The response of nursing staffs at the emergency department. So I had survey. I asked some questions to the nursing staff at the ED. Question number 1. Do you like the concept of paramedics who are usually working for emergency medical service or working with you at the ED? In the answer, 17 or 94% of them said yes, and 6% or 1% said no. And I asked some more questions. Do you have any concerns about paramedics at ED? And 22% says yes, and 78% says no. So the example of the concern. My concerns is only during the orientation. So the RN's roles and paramedics' roles are different. So basically RNs can't be replaced by paramedics because the roles are different, even though they're sharing scope of practice, the skill sets. And concern number 2, all healthcare colleagues need to know what the scope of practice for the paramedics are. And so we need to communicate clearly scope of practice and the certification for the procedures. Now, next page, next slide. They also asked, do you have any benefits in working with the paramedics at ED? and everybody 100% said yes, it's beneficial. The example of benefits are we complement each other. Their IV insertion skills are impeccable. They bring a lot of outside knowledge to drive to help and attentive to patient care. They all work hard and they don't shy away from the task. Assessment number 3. It's about the facts about costs and the training time. According to the ED nurse manager, newly graduate RNs take 9 to 12 months to fully train. And according to the Bureau of Labor Statistics, paramedics earned just under half as RN did in 2017. Recommendation. Based on the data collected for this report, paramedics share many skill sets with RNs, but they are economical and readily employable with minimum training. Therefore, extensive employment of paramedics as a feasible temporary solution is highly recommended. While new generations of RNs are under training. To work with the paramedics effectively and in harmony, however, their roles in the ED must be clearly and visibly communicated to all the staff and the patients. By doing so, paramedics can add unique pre-hospital experiences to the diverse team of Damas ED. Thank you.